pocket mouse, a big-eared bat, a flying squirrel, a red wolf, a spotted seal, a grizzly bear, a beluga whale, and me, an RN. What do we have in common? We're all on the endangered species list. There's a nursing shortage in America. I became an RN because I was a stay-at-home mom, and I decided I wanted to go back to work and I wanted to make a difference in the lives of other people. So I decided to become a registered nurse. I've been a nurse for 3.5 years and work with pediatric patients. There's a shortage of qualified nurses in America, and there's many reasons for this. This is a huge opportunity for Christians to become a nurse and to make a big impact through the lives that they touch every day when they're giving care to their patients and families. Why is there a shortage? There's so many Americans in the senior age bracket that are the baby boomers of America. They're retiring nurses, and there's a lack of qualified nursing instructors. There's 3 options to become a registered nurse. You can get a diploma, an associate's degree, or bachelor's degree. We're going to talk about those with the pros and cons. And also, it's an opportunity for Christians to share their faith on a daily basis through their work. So where are all the nurses? The United States Census Bureau says that the senior Americans are the fastest growing population age group in America right now. This is going to continue because the baby boomers started turning 65 years of age in 2011. So there's a lot more to come. They're going to be the fastest growing age group for many years to come. Ellen Olshansky, the editor of the Journal of Professional Nursing, reports that 73,000 nurses leave the workforce almost every year. Most of them leave for retirement reasons because they are too the baby boomers. So they're getting to the age of requirement. So they'll be leaving. This is going to leave a huge deficit each year of registered nurses. There's a shortage of qualified nursing instructors available to teach in the nursing institutions. They have to be master's prepared and experienced nursing, and as they retire, there's not many people to fill the ranks behind them. A lot of the reasons that people don't want to teach instead of becoming a nurse and working bedside is because you can earn a lot more money as a nurse at bedside than you can teaching. There's also a backlog of applications. There's many people trying to get into nursing schools, but only so many spots because of the lack of instructors. Roxanne Nelson in the American Journal of Nursing writes that 30,000 more nurses are needed each year than what are actually graduating. From my personal experience and from Donald Albin, who's a reporter and publisher, there are 3 paths to becoming an RN. The first is to get a diploma. A lot of hospitals used to have a diploma nursing program. They're becoming more and more rare as the bachelor's degree is becoming the preferred means of obtaining your nursing license. There's also an associate's degree, usually offered through a community college. This is a 2 to 3 year program where you can sit for licensure to become a practicing nurse, and then you can go to work as a nurse and have your employer pay for the rest of your education. This is a popular path for a lot of nurses. Then there's the bachelor's degree. This is the traditional 4-year college program to become a licensed nurse. You're eligible to sit for your boards and you go right into nursing. This is going to become the degree that everybody wants. All the hospitals are leaning towards bachelor's prepared nursing, and the American Nursing Association is also leaning toward recommending that this be the practicing nurse at the bedside should have their bachelor's. There's a huge ability for Christians to enter the nursing workforce and to make a difference. When someone is admitted to the hospital, we perform an admission assessment. We ask lots of different questions about everything in their lives, and part of the questioning can include a part of their faith. Are they Christians? Do they believe in another faith? This is a great opportunity to learn what their faith is and to share your own with them. You can also wear a cross necklace, a pen, something to identify yourself as a Christian. It identifies yourself to your coworkers and to your patients and their families and opens up a door of communication. Also, I like to keep little cards in my name badge. When I take my name badge out to swipe or to do anything else that I need to use my ID for, it would be left blank. So I put a little scripture verse with a little note of encouragement there. And I also carry some in the back of my badge. I have several here available so that when a patient or their family is going through a difficult time and they need a little bit of encouragement, it's a quick little way to leave them a little note and give them a little bit of God's message of caring right there on a daily basis. I can also request a chaplain to be able to come and visit the families. That's part of my job. When I see a family who's in crisis or needs some encouragement, we can request a chaplain to come to the bedside. I can stay with the chaplain and be a part of the prayer or whatever kind of encouragement that they are providing at the moment. And sometimes just a hug or a hand on the shoulder can be a lot of hope and encouragement to a patient. Barbara Pasut, who's a nursing professor, says that we are co-workers with God, and we can bring goodness in situations that appear devastating. And sometimes the families really rely on us to provide that support that they need. And it's good when you know where their faith is and where your faith is, because it can get pretty difficult sometimes at work with the situations, and to be an encouragement to others with their faith is very important. And also there's the opportunity for nurses to become a parish nurse, to work with churches and their congregations, or to work in a private office where you can openly share your Christian faith. So, we have a responsibility and an opportunity as a Christian. There's never going to be a shortage of patients. With the new medical care that's coming across through Obama's health care plan, more people are going to be insured and seeking health care. The baby boomers are going to be growing faster and faster and retiring and aging and needing more care. So there's never going to be a shortage of patients. And nurses are also part of this group of baby boomers. They're going to be retiring, and we'll be losing them at a fast rate as well. There are many options to become a nurse. You can do the associates, the bachelor's program, which are the most popular, to join the ranks quickly. And it's also an ability to share your faith, and it's the bonus of having a rewarding career. So now you know what I have in common with bats and mice and squirrels and wolves and seals and bears and even beluga whales. So if you want to become a nurse, or if you know somebody who's looking for a great career with a rewarding opportunity, join our ranks and take us off the endangered species list. Thank you.